Welcome to Pharma Knowledge. In this video, simplifying complex medical terms into easy-to-understand concepts because learning medicine should be clear and concise. Don't forget to like, share, and subscribe. Amnesia loss or impairment of memory, amputation, loss of part, or all of the limb or other body appendages through surgery or accident. Abdomen, the tummy area from the lower ribs to the pelvis. Abortion, ending a pregnancy using either medicines or an operation. Acute, sudden, and severe. Adenomyosis, endometriosis in the muscle wall of the uterus. Adhesions, scars that connects two or more body structures together. Amniocentesis, a way of testing the fluid surrounding a baby in the womb by taking a small sample with a needle put into the womb through the abdomen. It can be carried out after the 15th week of pregnancy and can detect some conditions like Down syndrome. Amniotic fluid, the watery liquid surrounding and protecting the growing fetus in the uterus. Amniotic sac, the pregnancy sac containing the baby and the amniotic fluid. It is sometimes also called the membranes. Anemia, a condition when the level of hemoglobin, the protein in blood which carries oxygen round the body, is lower than normal. Anesthesia, using medications to stop you feeling sensations such as pain. Anal sphincter, the muscle around the anus that is squeezed to prevent passing wind or opening the bowels involuntarily. Anaphylaxis. Anaphylaxis is a severe and potentially life-threatening allergic reaction that needs immediate treatment. Antenatal, prenatal, before birth. Anthracyclines, antibiotic drugs used in cancer chemotherapy. Antibiotics medicines to fight an infection caused by bacteria. Antibody blood protein that helps fight attacks on the immune system, such as those caused by bacteria and viruses. Anticoagulant medication, medicines to reduce clotting in the blood vessels. Antigen, a substance in the blood that helps trigger the immune system to develop antibodies. Anti-inflammatory drugs, medicines to stop or reduce swelling and redness. Autoimmune response, when the body produces antibodies which react against the body's own tissues. Bacteria, tiny organisms that may cause certain infections. Bacterial vaginosis, BV, a very common vaginal infection which results in discharge and soreness. It is caused by an imbalance in the types of bacteria in the vagina. It is not sexually transmitted and does not affect men. Bile acids. Bile acids are made in your liver and they help you to digest fat and fat-soluble vitamins. Intrahepatic cholestasis of pregnancy, obstetric cholestasis, is where you have a buildup of bile acids in your body. Biopsy, the taking of a small sample of tissue for examination. Birth asphyxia, when a baby has experienced a reduced level of oxygen around the time of birth. Blood group, the way blood is classified by proteins, known as antigens, on the surface of your red blood cells. Group A blood has A antigens, Group B blood has B antigens, Group AB blood has both A and B antigens, and Group O blood has no antigens. Body mass index, BMI, a measurement to work out the range of healthy weights for a person. It is calculated by dividing your weight in kilograms by your height in meters squared, that is, your height in meters multiplied by itself. The healthy range is between 19 and 25. Brachial plexus injury, damage to the nerves in a baby's neck. Breech position, when the baby is lying bottom first in the womb. Bicornuate uterus, womb, a heart-shaped uterus. Usually the uterus would be pear-shaped. Breech position, when the baby is lying bottom first in the womb. Bicornuate uterus, womb, a heart-shaped uterus. Usually the uterus would be pear-shaped. Cancer, a disease of the cells. Cardiotocography, CTG, a machine which traces the baby's heart rate and the woman's contractions before and during birth to assess the baby's well-being. Cephalhematoma, a bruise on the newborn's head caused by a suction cup being used to help deliver the baby. Cervical screening, an internal swab test to check your cervix is healthy. It is sometimes called a smear test. Chignon A swelling on the baby's head as a result of a ventouse birth. It settles within a day or so, chlamydia trachomatis. A sexually transmitted infection which can damage the reproductive system of both men and women if it is not treated promptly. Chlamydia is treated with antibiotics. Both partners require treatment. Chorioamnionitis, an infection inside the uterus affecting the membranes, called the chorion and amnion, which surround the amniotic fluid. Chromosomal abnormality, a different number or arrangement of chromosomes from the usual pattern. Clitoris, a small organ under a fold of skin at the top of the vulva. The external part is about the size of a pea. CMV, common infection caused by the herpes simplex virus that is spread from person to person by bodily fluids, blood, breast milk, saliva, and semen. Colostrum, the first breast milk produced during pregnancy and in the first few days after your baby is born. Colposcope, a type of microscope used to see the cervix in detail during colposcopy. It has a light attached and stays outside of the body. Anemia, a condition when the level of hemoglobin, the protein in blood which carries oxygen round the body, is lower than normal. Anesthesia, using medications to stop you feeling sensations such as pain. Complications, problems that develop after an operation, treatment, or illness. Conception, when an egg is fertilized by sperm and then starts to grow in the womb. Continence, having full control of the bladder and/or bowel. Cystocele, when the bladder bulges into the weakened wall of the vagina. A lump may be seen or felt. Dilatation and evacuation, D&E, surgery using instruments to end the pregnancy. Deep vein thrombosis, DVT, a blood clot that forms in a deep vein. Depression, a common mental health condition which is characterized by low mood or loss of pleasure or interest in activities for long periods of time. Diabetes, a condition caused by high levels of glucose, a form of sugar, in the blood. Diabetes type 1, a serious lifelong condition where your blood glucose level is too high because your body can't make a hormone called insulin, which controls blood glucose. Diabetes type 2, a serious condition where the insulin your pancreas makes can't work properly, or your pancreas can't make enough insulin. Diathermy, a surgical procedure to heat up and destroy body tissue or stop bleeding, also known as electrocoagulation, dilatation, the process of your cervix opening during labor. Dysmenorrhea, painful periods, dyspareunia, pain during or after sexual intercourse. Ectopic pregnancy, when a fertilized egg, embryo, implants outside the womb, usually in one of the fallopian tubes. Eclampsia, seizures, fits that are a potentially life-threatening complication of preeclampsia. Embryo, a fertilized egg, endometriosis, a condition where cells of the lining of the womb, the endometrium, are found elsewhere, usually around the pelvis and near the womb. Endometritis, inflammation of the lining of the womb, causing discomfort or pain. Endometrium, the lining of the womb, uterus. Epidural, an anesthetic injection into the space around the nerves in your back to numb the lower body. Episiotomy, a cut made through the vaginal wall and perineum to make more space to deliver the baby. Fecundity, being fertile. Follicle, the part of the ovary where the egg develops. Footling breech, when a breech baby's foot or feet are lying below its bottom. Forceps delivery, smooth metal instruments like large spoons or tongs, which are used to help deliver the baby. Gamma globulin, IgG, a natural substance in the blood that protects against disease and infection. It is also used as a drug to boost immunity. Gastroenteritis, inflammation of the stomach and intestines, usually resulting in diarrhea or vomiting. Genitals, the sexual organs. In a woman, the vagina and vulva, and in a man, the penis and testicles. Genital herpes, an infection caused by the virus herpes simplex, the virus that also causes cold sores. It is passed from one person to another by skin-to-skin contact. Gestational diabetes, a form of diabetes triggered during pregnancy. Gonorrhea, a sexually transmitted infection caused by the bacteria Neisseria gonorrhea or gonococcus. It is treated with antibiotics and can cause long-lasting damage in both partners if left untreated. Heart palpitations, when you suddenly become aware of your heartbeat pounding or beating more quickly than usual. Heparin, a type of anticoagulant medication that is given by injection. Herpes, a family of viruses which cause a range of infections including chickenpox, herpes zoster, or varicella. Cold sores and genital herpes, herpes simplex. Human immunodeficiency virus, HIV, a viral infection which attacks the body's immune system, making it hard to fight off other infections. Human papillomavirus or HPV, a common virus that most men and women will have at some point in their life. In most people, HPV will go away by itself without causing problems. A few types of HPV can cause cell changes that may develop into cancer. Hysteroscopy and endometrial biopsy, a small operation which opens the entrance to the womb, cervix, to remove tissue from the lining of the womb, the endometrium. Thanks for watching. Don't forget to like, share and subscribe.